because you went from nursing and then went back into running a private practice chiropractic clinic, I'm just interesting. What did you implement from your nursing lessons that when you, because the great thing about private practice chiro is like you get to decide what the methods are, right? You get to decide how we're going to deliver this. So was there anything you totally changed in your practice after that, or that you
I
modified
don't
compared
think
to?
I don't think totally changed. Like I had taken a lot of courses on education of the patient. I'd always like gone out of the way to educate. I would try to communicate the best I can, but I had done some like coaching also with communication in patients. Like this is probably 15 years ago. A lot of the stuff that you talk about, like I was just saying, like never sit, never stand above the patient, never turn your back to the patient, like all these things that are so easy to do, but if we don't think about it, you do it. Like, so, it is interesting though, like, cause my wife practices with me. She's, runs the office and she's like, you are such a better doctor now when I listen to you outside the door. I'm like, really? I'm like, geez, I wouldn't think my clinical skills have changed very much. And they probably haven't. It's just more about probably a lot more empathy and, patience.
Yeah, your wife's also like 4'10", so she probably makes you work hard at the don't stand over the patient and talk. You know, you're like sitting on the floor,
Yeah. That's,
crisscross applesauce. So tell me what's going on.
Well,
well,
that's an
that's
awesome compliment.
it is an awesome compliment. Yeah. But, cause I can be gruff for sure. Like today I was so irritated with the patient. He gets in there, he's 7 minutes late. He's like on his phone. And I was basically like, listen, dude, like, my wife was just like, oh my God, you gotta like tone it down. I'm like, it was so rude. I'm like, just get
Yeah,
off your phone before you come in my office. Like you're already behind. I've got patients waiting. Like, let's go.
Mhm.
And it totally affects the way my treatment was too. So I gotta just like calm the F down.
yeah. I think that's the part that's never addressed is like we are also humans that are getting annoyed, that are frustrated, that are tired, that just found out our kid is had to go home sick from school or whatever, and then you're just supposed to put that totally on a shelf and take that body and that psychology off, and then go into doctor mode and walk into the office like you did on every other patient that day. It's just
Right.
it's an impossible feat.
Right. Yeah.
And
That actually came to surface yesterday. A colleague of mine had to put a dog down over the weekend that had been with her for 15 years. And she's like, she's newer, fresh, like more out of school recently. And she was like, I'm struggling to put that hat off and like be happy and perky to patients that need me, because right now I need silence and a moment to myself to grieve. So it definitely is something that we struggle with as doctors on a daily basis, I would say.
yeah, it's a challenge. I mean, and like looking at this research, it would be, as one of my mentors said, man, this job is be so easy if we weren't dealing with these pesky humans. Ain't that the truth, man?
Imagine a practice where patient engagement is seamless and unified. With trust-driven care, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. Trust-driven care is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up.